In the past, the prospect of cutting into the body to alleviate sickness, only to have patients die from infections, was terrifying for both surgeons and patients. Somehow, we have progressed from that to performing robotic surgeries with patients going home safely just a few hours later. If you're curious about how all of this happened, hang tight as we dive deeper into the history of surgery, from its Stone Age infancy as a quasi-religious and supernatural craft to its contemporary status as a profession grounded in scientific expertise and technical skills. Chapter 1. Surgery then versus now. Before the understanding that microorganisms like bacteria caused illness and infection, cleanliness in surgery was virtually non-existent. Surgeons wore black, unwashed overcoats stained with blood, pus, and matter from previous surgeries. The coats only protected the surgeons from getting a patient's bodily fluid on their clothes, but no precautions were taken for the sake of the patient. Note that back then, the doctor's instruments weren't even disinfected, and at that time, patients would be strapped or held down on the operating table by strong men, with surgeons hearing their screams and feeling their thrashing throughout the procedure. Without the ability to render patients insensible, traditional methods to distract the patient's mind included opium, liquor, or hypnosis, which either had weak effects or posed risks of overdose. Other approaches were to use tourniquets or ice to numb the areas as much as possible. But back then, even when you are numb from the pain, you also have the pleasure of enduring the mental trauma of witnessing your own operations. As a result, the best way to reduce one's suffering during surgery in the past was to perform the procedure as fast as possible. Surgeons usually aim to complete a leg amputation in under 3 minutes to offer the least amount of suffering to the conscious patient. Yet this speed came at the expense of accuracy. Insufficient anesthetic agents and unsanitary conditions made surgery a terrifying prospect. Some patients chose to die from their conditions or commit suicide rather than facing the surgeon's knife. Nevertheless, the practice of surgery dates back thousands of years, evolving through immense challenges to become the life-saving field it is today. Now, let's take a deep dive into surgery between each era, starting with the ancient history of surgery. Chapter 2. Ancient Surgery. One of the earliest known surgical procedures is trepanation, or cutting a small hole in the skull. Practiced as early as 3000 BC, this method continued through the Middle Ages and into the Renaissance. There have been many instances of skulls that have been found dating back to Neolithic times that have grooves in them where portions of the skull have been removed. While there are no written records from that time, it is evident that Stone Age people were performing an early form of neurosurgery. Just imagine a shaman removing part of a skull to bring a possibly comatose person back to life. It must have been astonishing for people at that time. But did the patient survive? The short answer is yes. Many of these older skulls show new bone growth, which can only occur if the patient is alive. So when there is evidence of skull reformation, the patient must have survived the operation. Today, we know from modern surgery that the skull can be removed in a procedure called craniotomy in order to relieve pressure when there's swelling in the brain. This treatment method actually works, and patients' outcome improves significantly because of the reduced pressure on the brain. However, for ancient people, was trepanation a medical procedure or a spiritual ritual? It's hard to say, and in reality, it could also be a combination of both. Clearly, it must have been spiritual because surgery started as a quasi-spiritual endeavor. People with mental illness might have been yelling at walls and talking to invisible spirits, and perhaps the shaman attempted to release the evil spirits from their skull by removing a portion of the skull bone. On the other hand, a caveman or Stone Age person might have been injured during a hunt and suffered from a traumatic injury. The brain was swollen, and they were comatose. The shaman attempted to remove the injured portion of the skull, and the patient slowly became more responsive. It's incredible to think that all of these started 5,000 to 10,000 years ago. Perhaps due to its success, trepanning was widespread throughout Europe, Africa, and South America. For instance, it was also used in ancient Egypt to treat migraines. Other than trepanation, there were also other surgical procedures that were attempted early on. In ancient Greeks, there were multiple different surgical procedures performed, including setting broken bones, bloodletting, draining pus, and amputations. Instead of using stone, the Greeks had iron tools at their disposal to increase their surgical effectiveness and accuracy. However, the risk of infection or death was still high. At this time, the dominant medical theory was Hippocrates' theory of 4 humors, and it continued to influence medicine for hundreds of years. Hippocrates claimed that the humors, black bile, yellow bile, phlegm, and blood, respectively coincide with the elements earth, fire, water, and air, and they all exist in the body. He believed that sickness was caused by the imbalance of the four humors, and as a result, bloodletting, or the draining of blood, helped balance these four internal elements. Since we are discussing surgery in the ancient times, we have to mention a medical superstar at that time, Galen. He served for 3 years as a doctor to Roman gladiators and as the emperor's surgeon, gaining a lot of surgical experience. More importantly, he left a lot of writings speculating about the human anatomy, and anatomy has always been the holy grail of surgery, because to be able to cut into a tissue, you need to know what and where you are cutting. As a result, Galen's writing about the human anatomy had an enormous impact on medicine and surgery for centuries. His extensive writings speculated on human anatomy based on animal dissections, as human dissection was a taboo in ancient Rome. This led to many inaccuracies, as he assumed animal anatomy was similar to human anatomy. Despite these errors, Galen's influence persisted through the Middle Ages and into the Renaissance. His ideas, although often incorrect, dominated medicine during this period, making him a prophetic figure in the field. So we have talked about surgery in the ancient times. Now let's leap forward and explore how it evolved over the following decades. Chapter 3. The Middle Ages and Renaissance. During the Middle Ages, the churches and religions dominated much of society, including surgery. When a person was sick, the monks in monasteries provided care, although their methods were primitive by today's standards. The monks were aided by barbers, who originally performed tasks such as shaving and hair cutting, but gradually took on more surgical roles. This might seem like an odd transition, but when you think about it, these barbers had a lot of experience using blades on humans. As a result, it made sense for them to assist care providers in using their scalpels for surgery. So they were later known as barber surgeons, having inherited the barber profession while also taking on the role of surgeon during that period. However, these barber surgeons performed very basic procedures like lancing boils, removing bunions, and amputating mangled fingers. It's not surgery as we know it today. They were not doing liver transplants or complex brain surgeries. However, it was their hands-on approach that thankfully allowed surgery to continue and advance during this period. Unlike physicians, who studied at universities, surgeons learned their trade through apprenticeships, similar to blacksmiths. The barber surgeons were organized in guilds that governed their own training. Sometimes, surgical skills were passed down within families from father to son, a practice that persisted up to the Renaissance and into the 16th century. The separation between physicians' university training and surgeons' hands-on training also reflected a clear distinction between physicians and surgeons. Since the ancient times, physicians were always considered the educated elite and looked down upon anybody who worked with their hands. And of course, we could agree that surgeons in a sense do work with their hands and were considered manual laborers. This very demeaning attitude towards surgeons who did manual operations wouldn't change for centuries. At the same time, surgery during the Middle Ages was extremely dangerous due to the lack of adequate anesthetics and antiseptics, so it was viewed as a dangerous manual profession. Despite the harsh practicing environment, the barber surgeons continued practicing surgery and passed on their crafts until the 1700s, when surgical study became a part of university training. One notable surgeon from this period was the 16th century French army surgeon, Ambroise Paré, who served Kings Henry II, Francis II, Charles IX, and Henry III. As a child, he apprenticed with his brother and later continued his studies at Hôtel Dieu, the oldest hospital in France, and probably the oldest continuously operating hospital in the world. Dr. Paré developed an emollient of egg yolk, rose oil, and turpentine for treating gunshot wounds, which was better than the previous practice of cauterizing wounds with boiling oil. In his autobiographical book, Journeys in Diverse Places, Ambroise Paré described a practice that physicians nowadays call evidence-based medicine. He compared patients treated with boiling oil and cauterization to those treated with his emollient, and found that the latter group recovered better. Today, such studies are common in hospitals and universities worldwide to improve care, but at that time, the scientific approach to medicine was still overshadowed by long-standing medical beliefs. Paré also revived the practice of ligation, or tying off blood vessels, to stop hemorrhage more effectively. While he made significant strides in the medical field, his motto, "I treated him, God cured him," reflected the strong influence of religion and the common belief that surgeons could only do so much. As we transitioned from the Middle Ages into the Renaissance, the role of surgeons began to evolve. However, the demeaning attitude towards those who worked with their hands persisted. It wasn't until the 20th century that surgery was fully recognized as a respected and vital medical profession. But before we could get to really effective modern surgery in the 19th century, 4 key problems needed to be solved: understanding human anatomy, controlling bleeding, developing anesthesia, and ensuring antiseptic conditions. We'll explore these breakthroughs in more detail in another video, where we'll look at how pioneers like Andreas Vesalius, William Harvey, William Morton, and Joseph Lister transformed Renaissance surgery into the modern field we all know today. And that is it, everyone. I hope you have learned something new, and I'll see you next time.